Hello guys, here is Boston Asian Radio and TV station speaking. I'm now in the City Hall in the Eagles room near Mayor's office. Mayor Millor is going to host a language other than English and neighborhood media roundtable to discuss the newly announced COVID-19 policies. Let's go inside and see what she talks. Yes, thank you. So here is the Boston Asian Radio and TV station, and together with 波士顿中文网。
针对波士顿留学生群体，圆桌会谈席间，本台记者提问关于在新政策下，已在其他国家完全接种的国际学生是否还需要接打2针美国疫苗的问题。新任波士顿公共卫生委员会执行董事欧基库土博士表示，凡国际权威认证的疫苗，新政策下同样认可。
Which are vaccines that are not available here, but that other people have gotten and finished and completed their series elsewhere. If these vaccines are approved by the WHO, the World Health Organization, then they are acceptable here. People should be boosted, and the CDC has recommended that they receive their booster dose 6 months after the last dose, similar to what we do here, what we would recommend.
据部分中国留学生反映 ，CVS 等室内疫苗接种点存在拒绝为已完全接种海外疫苗并混打过美国加强针的中国学生接种第2针美国疫苗。对此，博士表示，目前新政策对加强针没有要求，学生持有 CDC 认证的完全接种疫苗证明即可。特别对于奥密克戎变种的加强防护，目前政策没有特别要求，一旦 CDC 给出明确指示，工作组会做出相应政策调整。
I would add, because I think it's very important, that boosting is incredibly important, specifically if we're, in the setting of the Omicron variant. We have not adjusted our policy to include that booster dose yet. Once we get the guidance from the CDC regarding that, we will add that to our policy.
此次波士顿严格室内疫苗政策出台后，也引起不少反对声音。席间，一位反对接种疫苗的女士一度情绪失控。
What other? Are they going to be fined? I can't force public housing to do the X, Y, Z, but you can force me to make a health decision? I'm confused and I'm angry and I'm upset that you're taking away my options.
We have to make sure first and foremost that they have a chance to be part of the world in the future as well, that they can be safe and healthy and alive and part of this community. We're not trying to force anyone to make a decision that they, for their own personal reasons, can't make or don't want to make. And there are medical and religious exemptions still built into the policy. There are also many ways in which the policy is designed so that people can still and have to still be able to access the daily necessities of their lives. Right? As Dr. Ojikutu was saying, nobody is barred from going grocery shopping, from doing things that are not as high risk indoors. But for eating inside, for going to a show, for going to the gym, in this moment, this is still a public health emergency, and so we have to take those actions.
We have to follow the data, and we have to realize that we're truly at the point where we need to encourage people to get vaccinated, to not only protect themselves, but to also protect our infrastructure, our communities, and to protect our ability to stay open as a city. The reality is that I don't see COVID going anywhere soon, right? You're nodding your head, so I don't see it going anywhere. We're going to have new variants. There's going to be pi, sigma, rho. We're going to have new variants, particularly if people are unvaccinated. We have to learn how to live with COVID. Our hospitals have to stay open. We have to be able to go to school. The way to do that is to get people vaccinated.
2TV 波士顿报道。